All right, everybody. It's so weird coming in silent now, man. I thought I was going to hear it in the headphones. But no big deal. No big deal. That's how we roll. Everybody, welcome to This Pink Cloud. We are a show that is recovery-based, but multiple pathways, right?
Absolutely.
Right? So, I'm a electronic DJ, DJ Kelly Reverb. Check it out. Google me, whatever you want. Sitting in with me, it's been, God, 6 months?
At least, man. It's way too long.
Yeah. So this is now and I use air quotes, professor, a.k.a. instructor at UNT, LPC, LCDC, the Vanilla Viking, I like to say the Charlie Manson of recovery.
My mom is not going to be happy with that.
Ladies and gentlemen, one Dusty Burrows.
Thanks, Kelly.
Yeah.
How are
It's
you
good to
doing,
be
dude?
here, man. I missed you.
Yeah, dude. I mean, it's been 6 months because, as the listeners know, my mom passed away about 6 months ago, so took a little hiatus. But now we're back, and we're better than ever.
That's right. It's good to be back doing
Yeah,
my
man.
thing.
Well, I'm proud of you that you got the gig at UNT. So what's the class?
It's an addictions class. It's covering all the basics, some physical stuff, some mental health stuff, some recovery stuff. So teaching this specific class has been a dream of mine ever since I took the class years ago. So I remember sitting in class going, man, I'd really like to teach this one day. So when the opportunity presented itself, I jumped on it.
That's great.
So hopefully the students like me.
And your first day was the other day. Were you super nervous?
Yeah, last Monday. Yeah, it was
Did you have to cut your caffeine intake?
No, I probably messed up and had double the caffeine, but it was cool. So.
You're like, our new teacher's on crack, dude. He's all sweating and stuff.
I just approached the class like a 45 client group therapy session for 3 hours.
Well, hey, that's good.
Just to get to know each other.
Well, and in recovery, I always tell people that, you learn to talk and you learn to be okay and comfortable because, it's okay to sound like a-hole.
It is sometimes, and that's okay.
Yeah.
You got to keep it authentic, right?
Right, exactly. Hey, I forgot to introduce, dude, my homeboy Fitz on the ones and sixes, not ones and twos. But
multitasking
today. Fitz is helping us out because we've got such a full house today. But you're with Hello Studios, and if they want to book, they can hit you up, right?
Yes.
And they've got your contact. You go ahead and give out your contact info.
Our website is www.imhellostudios.com, and we are the Airbnb of podcasts. So
I love it.
If anyone is
struggling
to start off
a
podcast, just come over here, become a member. We have everything provided. We have all the equipment, we have the personnel, and we'll just get you over that hump so you can get right to recording your important messages.
Yeah, because it's not an easy thing to do. There's a lot to it.
It's very technical.
Yeah. So, but Fitz is here to hold my hand. We're here to hold pinkies during the podcast, just to make sure it's okay. Yeah, he's there. But okay, so funny thing, we have I think the entire staff from NeuroGlow Clinic. And these guys, like I said, we like to celebrate multiple pathways in recovery. And I think that ketamine is actually one of those, potential helpers for, all kinds of issues. But before we get into that, I'm going to go ahead and have you guys go down the line so I don't step on everybody's name and mess everybody's letters up. But I'll start over here with you, Tina Marie.
Yes, my name is Tina Marie. I am with NeuroGlow Clinic. We have 2 locations, Flower Mound and McKinney. I do business development, build relationships out in the field, let the community know what we do, who we are, and how we can help people. I say business development, patient advocate. I'm pretty much the spokesperson for
You're
our
like
clinic.
the den mom.
Yeah, I'm the den mom. Feet's on the ground den mom.
Right.
Yep, that's me.
All right.
Yeah,
Okay.
and I'm Kathy. I am one of the co-founders of NeuroGlow. I have a background in nurse anesthetist. For a lot of people that don't know what that is,
Right.
It's a nurse who only specializes in anesthesia. So
Okay.
that's kind of how.
And what are those letters behind your name?
Yeah, so the CRNA, that's Certified Registered Nurse of Anesthesia.
Okay.
Yes.
Hey, real quick. So what's the difference between that and an anesthesiologist?
Probably like 300,000 more a year.
That's what I was thinking. Yeah.
Yeah.
All right. And then Momin?
Yep. So my name is Momin. I'm one of the co-founders as well of NeuroGlow Clinic. I'm also a nurse anesthetist. And Kathy and I, we started NeuroGlow about 18 months ago.
Wow. Okay.
And so we're still fairly new in a sense, but this whole kind of realm of ketamine in a outpatient setting is new as well too. So we like to say we're kind of trailblazing in a sense.
Yeah, for sure. I mean, because as I did some research, I think it was that they allowed it like as far as medical, application. I think it was 2019, right?
Yeah. So
Or decriminalized it, or however you want to phrase it.
So in 2019, actually, there's a medication called Spravato, which is an isomer of ketamine.
Okay.
Isomer meaning they basically took the ketamine molecule and split it into two, and then rebranded it as a new drug, and then went through the whole FDA approval process,
Okay.
which is about $100 million.
And who owns that specific brand? It's
yes.
Pfizer?
Close, Janssen.
Oh, okay.
Close. So it's one of the big
big farms, right?
I can't say anything bad about them
Oh,
on
sure,
air
hey,
because
dude, no,
they
it's all
might
good.
take me out or something.
That's all good.
Just to say, most of the research historically in the last 10 years have been on ketamine itself, not the isomer of it.
Okay.
They do work on similar pathways in a sense, but when you hear people talking about
When you say like the isomer, to whoever is listening out there, is the isomer maybe like a more pure form, or
No,
what are we saying?
it's actually ketamine itself is made up of two isomers, which is the R and S component, and they basically kind of fit together almost like a mirror. They're like mirror images of each other, but this company basically separated the two to create a new drug.
Oh.
All right. So ketamine itself is in generic form already.
Uh-huh.
So it's been around since the 1960s.
Well, I was going to say my experience with ketamine being, rave scene, 90s, they called it Special K, and everybody went to the K-hole. And I know Dusty, it never really intrigued me to do it because I was all like, oh, just Coke and alcohol is good for me, and maybe occasional MDMA. Yeah. But I know Dusty has tried it, and it was back in the glory days in the 90s, buddy.
Yeah, way over 20 years ago, I was very adventurous, you might say.
Experimental.
Sure. Not for therapeutic or clinical reasons. And so, I had some interesting experiences with ketamine.
Yeah.
But that being said, fast forward all these years later, I can totally see where there would be benefits, and lots of them.
Yeah. Yeah.
Well, so now you were going to you were explaining more the scientific side, but I just wanted to kind of introduce ketamine to people, and also they say it's like a cat tranquilizer, horse tranquilizer.
Well, it's interesting enough. This is how we kind of entered into this whole arena of ketamine, is because we actually used to administer it almost every single day to our patients undergoing anesthesia.
Sure.
And still a lot of people
it's
use
still
ketamine as an anesthetic in a lot of different
it's extremely
scenarios.
safe drug, actually speaking.
There's no propofol like Michael Jackson fall asleep forever kind of thing going on.
I mean,
you could,
it's
but
in the wrong hands.
I got you.
But
you gotta have the credentials.
Sure.
And that was really kind of our entry point into this whole space. So we could talk later about where we kind of came into it and where we're at now, too.
Well, I mean, go ahead. I mean, y'all jump in.
Okay.
So ketamine is used on humans as well as animals in an anesthetic setting. So whenever they say, oh, this is, Special K or cane used on a horse tranquilizer. It was really used to take down large animals because of the way that you administer it. You can administer it intramuscular, so you don't have to have an IV. You don't have to, put an IV in a large animal. You can just,
basically stab them with a large
right,
needle.
Exactly.
Right.
A large needle into the muscle and let it absorb and then take down the animal. So, I think a lot of people do, in that sense, know about horse tranquilizers.
In that aspect, because just, the street terms, and I mean, probably half the people haven't even really heard of it, to be honest. All the moms and dads out there, they're like, what the hell is ketamine?
Yeah.
But, I mean, from where we're coming from, that's kind of, what we understood it as. But, so what, as far as like, how y'all decided to do this and the business development behind it, like what, how did that happen? How, how did it, all of a sudden, hey, let's start up a ketamine clinic.
Let's do ketamine.
So it's an interesting story. So, like I said, I was giving it almost routinely to patients, and I just anecdotally used to see a difference in patients from pre-op to when I used to check on them in recovery. Like they would just be like smiling, like different demeanor. They were more
better mind.
Yeah,
really
they were
happy.
engaging it. And this was probably back in 2016. And the research was very small at that point, right? I mean, like I was Googling like ketamine, is there something with mood or something? It was definitely developing back then. I had this idea. I was like, oh, this would be great to give this in a clinic setting, help people. With that said, I was extremely narrow-minded in my vision. I was just, in my mind, I was like, ketamine, I can do this all day. Just give it to people. They're going to walk in. I'm going to give it. They're going to feel good, and you walk out,
Right. Well, except for the surgery part.
Yeah, except for the surgery part. But
But then they don't care as much if you give it to them, right? So, about the surgery.
So
right.
that's
They're
how,
happy.
and that's how,
Exactly.
me and Kathy really, kind of approached her like, hey, this movement's happening. We should just see what happens. And, we don't have a mental health background, right? And this is where the interesting part is how we kind of pivoted, in a sense, after getting experiential knowledge of ketamine, giving it to people with mood disorders or addiction.
Well, while you said that, I want to go down, like, because I was reading all the different things that it treats, which is, I hear depression, anxiety, postpartum depression, suicidal ideation, PTSD, OCD, and bipolar disorder. And that sounds like everybody I know.
Yeah.
Me too.
But I mean, and honestly, in recovery, we're taught that most people have co-occurring issues, which is some mental disorder, and then they have the substance on top of it and the actual physical addiction to that. So they consider that co-occurring. And this entire list is on that list, which I think, like, for example, I've had a lady, a good friend of mine on the show, who was diagnosed bipolar, but wasn't on the right medication. And every time she wasn't on the right medication, her medication was wine and multiple bottles. Yeah. So
that happens.
right.
Self-treatment, for sure.
So really, the most research with ketamine has been on treatment-resistant depression. So it's for people that have actually tried multiple other modalities. It hasn't worked for them. Then, they are more of an appropriate candidate for ketamine. And that's how we approach it at our clinic, just because now that it's become more popular, people are like hearing about it. Like Elon Musk is tweeting about it.
Right.
People, and then they would call our clinic and like, hey, I want to try this stuff. And I'm like, oh, so what's going on with you? It's like, no, nothing. I just want to try it. Like,
come in.
I just want to come in, but
or I think I'm depressed. I broke up with my girlfriend and now I need help.
Right.
So we do try to stay within the parameters of the latest research, in a sense.
Yeah.
We want to trailblaze, but in a responsible way. I think ketamine is a very powerful drug, and it can help a lot of people. But I also feel that if we are too cavalier in our approach, it can kind of set us back too. Right?
Sure.
So,
well, yeah.
The first time something bad happens with a patient or something like that, right? It's going to be all over the news. They don't talk about all the 100.
Well, another. Well,
Right.
that was kind of leads me to my next question. Is it can it be addictive?
So I would say every medication that we give in anesthesia or otherwise can be addictive in a sense, right?
Right.
Coffee, I'm addicted. I'll tell
I'm
you that
addicted to
much.
coffee. Yeah, I'm addicted to caffeine for sure.
But the properties of ketamine, it is not classified into a highly addictive substance. It's not setting off certain receptors in your brain like opioids, for example, or fentanyl, which you can hear about more. The experience of people getting ketamine is very similar to a psychedelic experience.
Right. Yeah. And that's another question. Yeah. So, like, I don't mean to leave you out. We're gonna get to you. We're gonna get to you.
You know what? Tina's always talking, so it's kind of nice to let Moment and Kathy.
Tina actually gets to listen.
Yeah, I'm actually paying attention. You guys, look at this.
No, Tina's background's amazing. She should talk about it for sure.
Right. Yeah, but okay. So first off, if somebody wants to experience this, like how? Okay, is it covered by insurance? And is it something that's affordable, or is it, kind of you got to have some deep pockets?
So that's a very good question, and insurance currently does not reimburse for ketamine treatment for mood disorders.
Unfortunately.
Currently, and the reason the drug itself is FDA approved as an anesthetic.
Okay.
Right? So the drug itself is FDA approved. It's not like some random new drug.
Right, but just the administration of it.
Administration for it for
that purpose.
Mood disorders.
And the reason why is because the drug is in generic form, nobody's taking that step to go through an entire FDA approval process.
Oh, you say because it's in generic form, so that means nobody's making money?
Well, no, nobody's
Exactly.
and it takes about $100 million, probably plus, to get a medication approved for another reason.
Yeah.
Right? So it's already approved as an anesthetic. It's in generic form.
Right.
So, there's not too many companies that are going to jump in and be like, I'm going to throw down $100 million.
Yeah.
And hence that's how Spravato was invented and formulated.
Gotcha.
So as far as the cost, I would say cost is a barrier for a lot of people. At our clinic, we try really not to turn anyone down if we think they really need the help. So
sure.
Yeah.
We have a lot of people in suicidal ideation. They are really tried everything else. And with all our staff, not just us, we're trying to train to listen to their patients first, even if they're calling in on their first appointment. And we go case by case. If somebody cannot afford it, we work with them in every way we can to get them in. And we don't advertise this on our website, but we treat quite a few people just pro bono. Especially veterans. We've had a lot of people, first responders, people. We know they need the help, and it's hard to,
of course,
get off the phone with someone that's like,
and go, oh, sorry, Yuri. Hey, dude, by the way, thanks for doing this incredible job for us as a society, but your insurance doesn't cover it, so see ya.
It's very hard to turn anyone away whenever they're in front of you and you see, there's a certain
desperation
that you see hear from them, their families,
right?
And it's very difficult. I mean, it definitely tugs at
sure.
your heart.
Well, and I was going to say you have a story about
and it's a good segue into Tina's actually going to talk now. My caffeine's coming back, you guys. Cuban coffee. But we had a veteran literally call. Me being a patient advocate out in the field working, I get a lot of calls. Working with patients from addiction to acute psych. My background's in acute psych, opening up acute psych hospitals. I left that world to go into the world of addiction and actually be on the ground. I mean, taking phone calls for the last 3.5 years, speaking to addicts and their families and hearing the struggles that they go through to either their insurance not working, where they can't get in, they're kind of stuck in the middle where they're not acute SI, but they're using...
When you say acute SI?
Suicidal.
Okay.
So acute in an acute suicidal, position.
I just like to spell out the terms.
Yeah, SI.
Yeah, come on.
We can make
SI, you know what that means.
You know what it means, right? Well, so this veteran called, he's on our Google reviews. He gave me permission to talk about his story today. A friend of friends said, call Tina Marie, she'll help you. I'd love to help first responders and military veterans. He was acutely SI, suicidal, waiting to get into Bonham, waiting for someone to call him back. Just that waiting.
And Bonham is
it's a military
mental facility.
It's mental health and addiction.
Gotcha.
So it's an
okay.
inpatient rehab, if
cool.
you will.
All right.
But we were able, I said, what would you do if we could treat you with, ketamine? What if I could get you in like tomorrow? He started crying. He said, I've been reading about, psychedelic therapy. I've been reading about ketamine. Kathy and Momin were gracious enough to help him out in a really acute state. He's full-blown alcoholic. We were able to get him in. I think he was on his third session before he said to us, I went to the grocery store, and it was the first time I did not hit the alcohol aisle. He didn't even look at it. And I spoke to him today on my way down here, and he said, Tina Marie, I'm going back to work. Today's my first day back to work.
Wow.
And he said, I actually feel like a civilian.
Wow. So and how many treatments how many treatments was that, and what would you recommend?
Right. So the most studied is 6 infusions within a 14 to 21 day window.
Okay.
More and more research is coming out, kind of extending that time, 21 to 30 days. And so we always tell our patients, it's always on a case by case basis. Not everyone needs the 6 infusions initially. Some need a little less, some need a little more, but 6 is the most studied.
Well, and then that's where I was going to get into, like, as far as the dosage, what you would consider this like micro dosing. I was joking with Kathy before the show. I was like, oh, so this is a situation where I lie and say that I'm a heavier weight. I'm a good 330 pounds here, so.
I think some people have tricked us before, but now we have a weight scale.
Yeah, right.
That we wear patients now. So, but that's a good question. We do, ketamine really the benefit is on lower doses. Actually, it's not. You don't want to give a dose where people are just passed out and they don't even remember what happened, and they're just like,
Right.
So at the low doses, which are, I don't want to bore listeners with.
No, this is all. It's fascinating to me, man. I've never heard this. So
it's
bring it.
We start every patient at 0.6 milligrams per kilogram, so it is by body weight.
Okay.
The most studied dose is around 0.5.
Okay.
So we start a little bit higher, but we don't try to do a cookie cutter approach to each patient. Like, you're going to metabolize drugs different than me and Kathy. Right. So we do make dose adjustments along the way. So usually around after the third or fourth session, we know what's a very, very good dose for you. Meaning, when we adjust our doses, sometimes it's just too strong.
Oh, yeah,
people have really strong, basically psychedelic experiences.
Oh yeah.
Right? And
overwhelming experiences.
It could be overwhelming to people, and people talk about dissociation with ketamine.
Well, and I think that gets to borderline K-hole, right?
Yeah, we definitely want to stay away from that.
We don't want to go by the K-hole.
That's too much.
Right, no.
Right.
But, go ahead.
That brings me to a couple of questions that I had. So you guys had mentioned earlier that they're not mental health professionals. So I was wondering, do you partner with clinicians in accordance with the ketamine therapy? Because, like, I work in a program with medication-assisted treatment, specifically Suboxone. And the research shows the efficacy of the Suboxone works much greater with counseling and working an active program of recovery of their choice. And ketamine, it would seem to me, would have that same benefit if it's working very well all by itself. What if you add the counseling and then working a program of recovery, whether it's mental health recovery or addiction recovery? What has your experience been with that? And do y'all partner with clinicians?
Wow, perfect.
Yes.
I love this
Bravo.
question.
I like where we're going with this.
So that is the future of NeuroGlow, actually, in a nutshell. Mo and I, we use ketamine in an anesthetic setting. We use it, administer it to our patients, but we are not in the mental health field. So we know what our capabilities are. We know where our limits are, and we are adding professionals who this is their specialty to come on board to help us. Like the one thing that for me, why we saw that this area was kind of lacking and missing is because, after we give our patient ketamine and after the 6 infusions, they look at us and they're like, okay, I'm doing better. Now what? Where do I go? And it's very difficult to tell them, come in for your boosters and just kind of release them out in the world. So, yes, we are looking into adding a lot,
Yeah, I was going to say, like, when it's going on, like, I mean, are y'all actually talking to them?
We are.
So our protocols has changed significantly from when we first started 18 months ago until now.
Sure.
We have actually added a ketamine integration coach into our program.
Okay.
So everybody that goes through our program actually has 2 sessions with the integration coach. She's not a certified counselor per se.
Right.
But she is actually certified through Being True to You. It's a company that actually specializes and trains people to deal with people getting psychedelics, so psilocybin, ayahuasca.
Right.
So she has a lot of experience with those other drugs, if you will, substances, psychedelics.
All in the same category, yeah.
Well, they can also be considered an entheogen as well.
Yep.
Yes.
Ayahuasca.
Yes.
Yep.
And so we see, the outcome of our patients who just get the ketamine, especially in our infancy stages when we first open, to now having those sessions, and we see such a huge difference in our patient long-term outcome. And
a lot of people end up, one of our philosophies with ketamine is we tell people from the get-go that the change that happens long-term it happens from the inside out in a sense. You got to put in the work. Right. Ketamine is there. It helps on a neurochemical level.
Well, it's like people say, like, oh, well, you did ayahuasca, so you're completely changed. You're like something magical happened, or it's not like that. It's actually, but for me, I would imagine that it would bring up certain things that maybe you weren't thinking about in your subconscious to your conscious mind, and then being able to deal with that.
That's exactly, and that's what we started seeing. People were, some pretty complex traumas and stuff were coming up, childhood stuff, and that's when we're like, look, we have to make that pivot to kind of provide an ecosystem for patients. So right now we are actually starting to partner with, and Tina can talk about this, but with LPCs, with therapists that are trained. They're trained in their mental health capacity, but I will say this is still in infancy. We did reach out to a lot of therapists when we first opened up, and there was a lot of cold shoulders initially, right?
Yeah.
They were like,
well, a lot of people find it counterintuitive that are in recovery. That's why we're talking about this on a basic recovery podcast or webcast. But the thing is, if it's actually helping and you're doing it in a responsible way, under medical supervision, and you actually see results, then I'm like, yeah, no brainer. Yeah. But a lot of people in recovery are, definitely, as far as, like almost like teetotalers, where, that something that is a Schedule III narcotic, cannot be good, to help you.
Yeah, I'd also like to say it is interesting that you guys bring up stigma, because I for one am a very pro psychedelic therapy and recovery advocate, and the conversations that I have are either very black and white. Either people are very for it or very against it. But what I found interesting, especially in the 12-step community, and although individuals might not say it publicly, psychedelic-assisted recovery has always been kind of that door that's open for them, that they could say, well, I could give that a shot and I wouldn't have to go get my chip again. Now, I don't know how well that would go. And I'm having more and more of those conversations, and I don't know if it's because of the traditional knowledge that Bill Wilson experimented with LSD, but it seems to me that in a traditional abstinence-based recovery movement that we know all so well, that something a little outside of abstinence is kind of starting to be welcomed with people, especially when we're seeing research all over the planet that's very pro, and we're seeing the numbers to prove it, that it's helping with alcohol use disorder, it's helping with all the mental health disorders that you mentioned.
Why are you looking at me, man?
Yeah, he did, Curly. He gave you a really...
He goes alcohol disorders, and he goes mental health disorders.
He looked right in your eyes.
He looked into my soul.
He did.
That's what I do. So yeah, I'm really excited about what's going on here, and I'm really excited to see how it's evolving.
Right.
That's cool.
I wanted to see kind of maybe your opinions on how maybe some of the other drugs are up and coming. I'm sure you guys keep up.
Hey, before we get to the opinions, I got a commercial I got to do real quick.
Let's do this.
Yeah.
We have a sponsor, and it is Max the Axe with Lone Star Personal Injury Attorneys. He is actually out of Houston, but he specializes in law in Texas, personal injury law in Texas and in California. So I met him, and totally good guy. And then all of a sudden I find out he's a personal injury attorney, and then he's like, "Oh, I'll sponsor your show, dude." And I'm like, "Okay." So it was just kind of one of those kismet things. And then he decided to actually grab the URL, This Pink Lawyer. So he grabbed thispinklawyer.com, and if you go to thispinklawyer.com, it will reroute you to their site, and it is Max Paderewski. It took me forever to get that right, but it's
Paderewski, huh?
Max Paderewski, and they're with Lone Star Law, personal injury attorney. So if you need any of them, tell them I sent you, and they will hook you up. Now, back to what you were saying, Dusty.
Thank you, Kelly.
Yes. You know what, Dusty, before we move on, before I lose this train of thought or we go too forward, being out in the community, right, the stigmatism of therapists and doctors really not being so open to ketamine. There's a lot that are, and I think they're afraid to say they are because it's kind of been in the closet. But now I'm finding with that show that came out, How to Change Your Mind on Netflix, I will start talking to a physician or a professional or people in the world of addiction and tell them what I'm doing now. I left the world of putting patients into rehab because I feel that there's more to offer than just going into rehab's great, right? The 12-step program's great, but what about the patients that are treatment resistant? Well, now this show on Netflix has really been great for us because they're like, "Oh my God, I just watched that show on Netflix. Do you guys do that?"
Yeah.
So it's
just
been
more about patient education. The more exposure, the more patients we can reach, and the more that we can help.
Yeah, and it's a good thing, you know. And it really is for treatment-resistant patients, where going into rehab 17 times. Okay, what can we do different?
Oh yeah,
It's time to change it up, guys.
Yeah, I love that you mentioned that, because if you work a program of abstinence-based recovery, whether it's 12-step or otherwise, and that's working for you, keep doing what you're doing. But my audience is all of the other people who aren't finding success in traditional pathways of recovery. They're getting lost in the shuffle, you know, and these alternatives, if you will, or non-traditional, hopefully they can become mainstream and current and acceptable, and help all those other people that right now are on the fringe.
Well, just like we always say, it's just another tool in the toolbox.
Just another tool in the toolbox.
I mean, like cognitive behavioral therapy. I'm a fan of that. I'm also a fan of the 12 steps. But hey, if this is something that can possibly be a fit or a fix, then I say, bravo.
Right.
Yeah, I had a client the other day mentioned to me that they had talked to their doctor and said that they were going to check out Recovery Dharma, which is my preferred pathway.
Right.
And the doctor actually rolled their eyes.
Explain to the people what Recovery Dharma are.
Yeah, they rolled their eyes at the patient because it wasn't a traditional abstinence-based 12-step recovery.
Yeah. Well, no, but
So
explain to everybody what Recovery Dharma is and give that a plug.
of course. So Recovery Dharma is Buddhist pathway to recovery, utilizing the Four Noble Truths.
Not
and the
religious
Eightfold
based,
Path. It's not religious based. You don't have to believe in anything but your own empowerment for change. So as opposed to a pathway of powerlessness, this is a pathway of empowerment, right? And it's very non-traditional in the sense that we don't identify as alcoholics or addicts, right? You don't necessarily even have to be 100% abstinence, but you're going to come and you're going to learn how to rethink and retrain your brain, and also start your recovery from the inside out. Learn how to love yourself, learn how to forgive yourself, learn how to be a better person to you. That way you'll be a better person to everybody else. So how can I learn to forgive? How can I learn to love others if I haven't practiced this on myself first?
Right.
So it's a fantastic, and it's been around, 500 years before Jesus. So, it's been around a while.
Wow.
So, and so we have people, about half of our community is 12-step people, and about half of them aren't.
Right.
And so
the thing that's also cool about Recovery Dharma is you don't even have to be like substance, have a SUD, which is substance use disorder. You don't have to have that in order to go. You can just go because maybe you're sad that day.
Yeah. It's very good for process addictions. We've had people in there that are just healing for really tough divorce, codependency.
Yeah.
Everything can be an addiction if you allow it or get caught up in that. We have people that are addicted to their own feelings of depression. That's where their familiarity is, their depression or their anxiety. So they go to that. It's not a substance, it's not a process, but it's a familiar place that's not serving them.
Right.
So.
Right. That's interesting.
That's pretty powerful, Dusty. Thanks for sharing that.
Yeah. RecoveryDharma.org, or you can come see us, Recovery Dharma on Wednesdays in Plano.
Yeah.
So
where are y'all
check us out.
located? Are y'all still?
We're still at the Mystic Mandala Center over
Love
off
it.
Spring Creek.
And give a shout out to our boy
VJ and Nanda are out there.
Vijay. Vijay. Get it right.
This guy. I don't know why he throws the accent on there. That just makes me uncomfortable.
So I'm thinking I'm thinking that would be really cool to, I think that's cool that y'all have like an advocate or a ketamine coach speaking somebody through it. But I think that would be really cool to marry the two and have like actually a therapy session on ketamine.
Oh, I do too. I'm looking to get trained myself because the more and more I read, especially there's so much stuff on LinkedIn that it just seems like a really great path to go down. I wanted to ask you guys, I'm sure you're following all the research too. I know MDMA is clearing all the clinical trials. Psilocybin is being legalized, decriminalized. Yeah. Of course, THC is everywhere now in all sorts of forms. Right. What are your thoughts and opinions on what's going to be the next big thing? What do you advocate for? What do you think is great, and what do you maybe on the fence about?
Well, just circling back real quick with ketamine itself and research that's coming out. The research on addiction is coming out really strong with ketamine, and there was a study that was published about 3 months ago out of the UK that they treated people with alcoholism with ketamine with psychotherapy, and at the 6-month abstinence rate was 87%.
That's amazing.
So the research is catching up to what we're doing now, and just like it is with MDMA. And psilocybin as well, which there's multiple MDMAs in phase 3 clinical trials now, meaning it's at really almost at the last hurdle.
So like when that happens, will possibly y'all control have that as well?
For PTSD,
for sure.
Especially for veterans.
Right.
For the veterans and the officers, and there's a foundation here in Texas that we're hoping to be able to partner alongside with, and you can look him up. His name's Marcus Capone.
Okay.
And he is one of the guys pioneering and going to Congress and really trying to get these laws passed. And he helps out a tremendous amount of veterans with it, and first responders. He actually has. We'll plug Marcus right now. He doesn't even know it, but let's plug Marcus Capone.
Okay.
Ex-Navy SEAL has a really good story.
He has a really good story, but we're going to be on the forefront. We're ready. We're ready for what's next because we can't stop with ketamine.
Sure.
And I think just being open 18 months and seeing the amount of people that lives have been changed is giving us this immense spark to be excited about the other stuff like MDMA and how many people it can potentially help, especially in Texas like this. I think the number two state in the country with the most veterans, is Texas. So
for sure.
I mean, I think it's going to be huge here, and the fact that MDMA is actually going through the right process in a sense, that it's going through the FDA approval.
Right.
So
not like how
it's getting the credibility.
Right.
That
not like how it started. y'all don't even know this, but y'all might be too young for this. But there's a place that's down the street from here called Start Club.
Okay.
Yeah, literally, there was a therapist back in the day that I guess maybe discovered it or something like that, but. They would actually go and serve it on trays at the nightclub.
Really?
They would just walk around with what they called ecstasy on trays down the street.
That was on that show.
Yeah.
Yes, it was. Yeah,
it was.
It is
on
true.
that show.
We need to bring that back.
Well, look, hey, you know, but the thing is, with MDMA, I have never seen anybody angry on MDMA.
No.
No, we're ready.
I've seen them in a cuddle puddle, but
You know, it's funny you said that. I've never ever heard anybody say, "Oh yeah, I was addicted to acid or I was addicted to mushrooms." The addictive qualities of psychedelics aren't the same as other things. And back to veterans, for them to have an alternative treatment aside from opioids and benzodiazepines
and alcohol.
is going to be alcohol.
Yeah.
I always tell this story, but I never knew they made pill bottles this big until I met a veteran who was being prescribed hydrocodone in these massive, almost like a liter bottle.
Wow.
And of course he developed
because that's gonna help your
Right.
PTSD, dude.
Yeah.
Throw some hydrocodone at your
Sleep all
PTSD.
day.
Yeah, I even ran into a guy in the bar about 6 months ago, and he came to me, started telling me his story, and he was under the influence, and he said, "I just don't have any feelings anymore. I'm walking around," and he goes, "Dusty, look what they put me on." He just starts emptying his pockets of all the different
Dude,
prescription
did he have
drugs.
the old fishing tackle box?
He just had a lot of pockets, and they were all
pharmaceuticals?
filled with prescriptions that he had got from the VA. And I was like, man, no wonder you have no feelings anymore.
Yeah.
And it was really sad. So, as you guys were sharing, I was thinking, what was that guy's name? I got to get it.
Actually,
Get him over to NeuroGlow.
Yeah.
And I actually had a patient similar to who you were talking about is, it kind of hit me whenever he explained it this way, but he was walking through life and with his diagnosis of major depressive disorder, and he said, with all the medication that I'm on, if you came up to me right now and sawed off my leg, I just really wouldn't care one way or the other. And to me, I'm like, how can someone just go through life feeling that way every single day with no hope? So
well, and with okay, so like you said, feeling that way. This is a question that I've been wanting to ask. So what does it feel like? What does it feel like? I know it's different for everybody, but what does the patient's experience? Is it like euphoria? Is it like, and I mean, here, dude, you can jump in too because you have experience.
Yeah, it's euphoria. It's all definitely some psychedelic experience. And granted, I wasn't taking it in a therapeutic dose for therapeutic reasons.
Right.
But as I mentioned before, that's why people go back to certain drugs over and over again, because it does something for them. So if you've had psychedelic experiences, whether it be ketamine, psilocybin, LSD, MDMA, you know why you went back the second time and the third time.
Right.
And so to be able to shift that, to do that intentionally and with some spiritual and therapeutic guidance.
I was going to say, and when the sun is up.
And when the beat dropped.
Yeah.
So it has so much potential, I think.
Right.
I have a real life story, and I think for me, living with someone who, this was just back in April, and Momin and Kathy and I met. I think it's been a year ago now. You guys, it went by kind of fast, but to live with my own family member who went through a very deep, dark hole and depression, and woke up one day and was on the floor in a fetal position, and I had to take the guns out of our house, call off work. I couldn't call the police and have a 72-hour hold because of other reasons, but it just came to me. I was like, he needs ketamine like right now. I got to get him in. And Momin and Kathy were able to get him in our clinic the next day. And to watch your own family member go through, he was going through a traumatic situation. I won't go into too much detail, but it was bad. It was really bad in my own house. So to take this person, this human being that you're related to, and watch them go through it, and not know, when you're on the car ride home going back, you're like, is this person going to want to kill themselves when I get home? Because what do you do?
Right.
I called and family came in from Houston and all over to like kind of sit and be there. And, he woke up maybe 6 hours later, took a long nap and woke up and was smiling.
Wow.
I hadn't seen a smile on this guy's face.
How long is the experience?
So during the infusion itself, it's a 45-minute infusion. It is through an IV. We do have to start an IV, so it is intravenous. The experience that they have is during that duration, the 45 minutes.
Okay.
And then once the infusion is done, it takes patients anywhere between 20 to 30 minutes to just come back down.
Reacclimate.
Right.
Yeah.
Reacclimate and just back to
Okay.
baseline.
And then do y'all usually, like, as far as safe practice or whatever, do y'all have somebody that drives them there and back, like just like they would go to surgery?
Exactly.
You're not going to let somebody.
Exactly.
Definitely can't drive after.
Yeah. Right.
No driving home.
Right. Yeah.
But we do also try to set up the environment so it's a very private thing. Unfortunately, a lot of the studies and maybe some places out there still do it like this, but they do it kind of like in a big room and you're looking at like random strangers and
people.
We think this is a very private experience.
Yeah.
So all of our rooms are private.
You got like one person like hysterically laughing and one person crying.
Exactly.
They're like looking at each other. Like,
what am I supposed to do?
Yeah, right.
Hug it out.
Right.
But we feel like that actually really aids in the whole experience that the patient gets. Their mindset going in.
Yeah.
Like
Set and setting.
We really prepare them for that first experience too as well. It makes a big difference on what they feel during, right? If they're coming in super anxious, scared, they're going to have their experience is not going to be that good because your brain takes you to weird places.
You have no control over where you're going to go.
Right.
You don't know.
So
Right. Well, I mean, when I did ayahuasca on a retreat, it was all about setting your intentions. Yep. So I think that probably is a similar thing you would want to do if you're going to.
Right.
And that's what our integration coach really helps with is to get that framework, the mindset going in.
Right.
And we also encourage people. Most people that come to us, they have some type of therapist or at least some kind of ecosystem in place for their mental health. We always tell them, like, keep an open communication with all these people. Don't do ketamine in this vacuum where you think you have to be secretive. Let people know you're doing this. You might start changing, and you need that help around you, right? So we tell people ketamine itself, it's going to do the work on the neurochemical level, but when that stuff starts working, you want to grasp all those changes. So family members are going to help you. Therapists are going to help you.
Collective effort from everyone.
And those are the people that get the longer term, what we see, longer term benefit. Right. So.
And also adding in now, we've just recently, our ecosystem is coming to like a complete circle. Like all our circles and rings are closing. So we're figuring a lot of things out as we go, but now also we're incorporating meditation. So we're working with this guy right now. He's amazing. You can look up his Instagram, Damian Ryder. He comes from a very abusive childhood. He has a lot of trauma. His name's Damian Ryder, plug, and he's one breath meditation. So now we're working with our patients because even my own family member had anxiety on the road trip there. It was a 20-minute trip over to Flower Mound.
Right. Yeah.
And
people think all this crazy stuff like you have to go. I got to go to the jungles of Peru.
Right. You don't know where you're going to go on your journey while you're in there. And so we just recently added, having our patients, encouraging them to listen to one of Damian Ryder's one breath meditation on the way into our clinic. And then possibly after, just to kind of keep that calmness in their system and be open.
Recenter yourself.
Recenter yourself.
That's good stuff.
And then one other thing that we do that really helps with the experience is there's a company called Wave Path. They're also, I believe, out of the UK, but they're basically a company of sound engineers, and they've sound engineered specific
frequencies.
You guys are probably know
I do. I'm EDM,
dude. The binaural beats and everything.
Yeah.
They've actually kind of have all these soundtracks that really kind of take people on the journey, and it's really cool to listen to. But they've actually timed it. their frequencies on how ketamine is working in your body. So
right.
like at the 7 to 9 minute mark.
Oh, I like that.
When you're
little,
starting,
yeah.
You started.
You got a soundtrack.
Yeah,
exactly.
And then when you're starting to come down, it changes up the frequencies.
Yeah.
And
Right.
It's amazing. It keeps people grounded.
Right.
You know, they're like, okay, I'm here. If they're getting anxiety, it really helps with that.
It absolutely does. I went to my first sound healing on Wednesday.
Oh, really?
Nice.
I love some sound bowls.
It was like being
like
encompassed by sound and frequency. It was the coolest experience. I could totally.
Was it on a sound bed or what?
It was using the singing bowls.
The singing bowls are the
Oh,
joint,
nice.
dude. I love the singing bowls.
It was cool.
Yeah, which is funny. Next week we're actually going to have somebody on from Two Birds Church, and they we're going to talk about my ayahuasca experience, and we're going to talk about all this alternate therapy is what I like to call it. But they're all into the singing bowls and stuff, so that's good. Hey, but everybody, please subscribe, share this with your friends. That's how we grow the show. Comment, like, blah, 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 right? That includes all of y'all,
yes,
by the way.
Of course.
And then, of course, you don't know but you're going to be sponsoring the show, so no, I'm just kidding.
The next show.
We'll be
Just kidding.
That's right.
No, it's all good.
Yeah.
But, I want to thank you guys for coming out. Fitz, thanks for sitting on the board. Hello Studios, of course. And then thank all of y'all. And then where can they reach out to you? What's the best way? Is there a phone number, website, what?
Best would be website, neuroglow.com.
Okay.
It has all our information
And
on
spell
there.
that because...
It's neuroglow.com.
Okay.
Yeah. Or you can call us 1-800-975-3859.
Okay.
And one of our team members will get you set up.
Perfect.
We're on Instagram and Facebook as well.
Right.
Just
all
type
the
in
all the soch.
Just
All the
Neuroglow
soch.
Clinic in Google, and you'll find us.
Okay, cool. Well, I appreciate you guys coming out and sharing
Thank
this
you so
because
much.
I think this is
Nice.
a super important thing, a thing to talk about. Did you have anything you want to add before we?
Well, absolutely. I want to give a shout out to Recovery Dharma Plano and Dallas, 2 locations, one Sangha. You can join us every Wednesday at the Mystic Mandala Center. Also, I wanted to give a shout out to Texoma Community Center, who writes my paycheck.
Right.
We're serving Grayson, Fannin, and Cook counties, the local mental health authority and outpatient treatment center. We're at texomacc.org. And last but certainly not least, where I practice out in Flower Mound, sessionswellnessgroup.com. Check us out. We offer a lot of different services there. So thanks, Kelly.
Yeah, no problem.
Thanks, Kelly.
Thank you, Kelly.
Well, thank you guys
you,
for
Kelly.
coming out.
Thank
you.
And
Thanks, Fitz.
yeah, for
You're
sure.
welcome. Thank you
And
for
then
coming.
be sure and share it. And then I guess that's all we got, right?
All right.
Yeah.
Time for the outro.
Yeah, there you go. Hey, well, everybody remember, there is no magic pill for sobriety because if there was, we would all do too many.
Excellent.
You got the outro?
All right. That was fun.
Don't